Ultrasounds. Introduction. Ultrasound is a type of medical imagery that uses ultrasonic waves to screen a particular part of the body. It uses the reflection of the waves when they hit boundaries between two types of tissue to create an image of the body. It was first used for medical purposes by Ian Donald in 1956 to see unborn babies. It is now used to diagnose the cause of pain, swelling, and infection in the body's internal organs, examine a pregnant woman's unborn baby, help guide biopsies, diagnose heart conditions, and assess damage after a heart attack. Physics in ultrasound. The main physics concepts that affect ultrasound are frequency, wavelength, and velocity. Frequency is how many waves occur per second. A human can hear sound waves with a frequency between 20 and 20,000 Hz. Ultrasound generally uses frequencies from 1 MHz, 1 million Hz, to 10 MHz. The wavelength is inversely proportional to frequency, so the higher frequency, the smaller wavelength. A wavelength is the distance from one crest to crest or one trough to trough. Therefore, smaller wavelengths have greater frequency. As a result, better resolution is achieved, but less penetration is present. There are two main types of ultrasound: a high-frequency probe and a low-frequency probe. High-frequency probes have better resolution, but they do not penetrate as far as a lower-frequency probe. A low-frequency probe is used to see structures deeper in the body. Another important factor in an ultrasound is the velocity. This is measured by wavelength times frequency. The harder the tissue, the faster the velocity. The average velocity in soft tissue is 1,540 meters a second. This is the sonic spectrum. Ultrasound uses ultrasonic waves which are above the human range of hearing. This is a table of frequency versus penetration, wavelength, and resolution. It clearly demonstrates the inversely proportional relationship between frequency and wavelength. The high-frequency probe has a relatively small penetration but greater resolution, and the low-frequency probe has lots of penetration but little resolution. Reflection is the only type of tissue interaction which gives readings back to the probe for the ultrasound. A reflection of the beam is called an echo, and the production and detection of echoes is how ultrasound works. A reflection happens at a boundary between two materials, providing the acoustic impedance is different. This is the product of the density and the propagation speed. Some of the wave is reflected back to the probe. The amount depends on the difference in acoustic impedance. P times S equals acoustic impedance, where P is density and S is propagation speed. The table shows the amount of ultrasound reflected depending on the type of boundary. The amount reflected is how much of the sound travels back to the probe when the boundary is reached. Less sound is then able to continue to travel further into the body. This becomes a problem when boundaries of air and soft tissue are hit because of the 99% reflection rate. A high-frequency probe has more resolution and less penetration than low-frequency probes, as the reflection rate is greater. The smaller wavelengths are reflected much more than the large wavelength. Other tissue interactions occur, such as attenuation, scattering, absorption, and refraction. These create some random error, so not all the ultrasound is sent back to the probe. This is an example of how ultrasound waves are reflected back to the probe using reflection. These are some types of ultrasound tissue interaction. Application of ultrasound in medicine. Diagnostic sonography is an ultrasound-based imaging technique that is used to visualize body structures such as tendons, muscles, joints, vessels, and internal organs. This is used to find possible pathologies and lesions. This is very effective for imaging soft tissue of the body. Sonographers typically use a handheld probe, called a transducer, which is placed and moved over a patient. A special water-based gel is used to link the ultrasound between the transducer and the patient. There are three main types of ultrasound that are used for medical imaging. These are A mode. This is the simplest ultrasound. A single transducer scans a line through the body and uses echoes that occur to plot depth. This is used to target a specific tumor or calcius. B mode. B mode ultrasound is a linear array of transducers simultaneously scanning a plane through the body. This creates a 2D image. M mode. A M mode ultrasound is a rapid sequence of B mode scan. This creates a motion of pictures. This means the doctor is able to see and measure a range of motion-related concepts, such as velocity and distance. Benefits and disadvantages of ultrasound in medicine. Ultrasound is a very simple medical procedure. It is painless and also easy to use. It is much cheaper than having an MRI, which is another medical imaging technique similar to ultrasound. MRIs cost between $400 and $3,500, depending on the part of the body being scanned. An ultrasound costs between $99 and $300, making it the much cheaper option. Ultrasound screening are quick and painless, and doctors can examine and determine the cause of the pain within the hour. This means that treatment can begin for ultrasound patients that day. An MRI scan has an average of 24 hours required to be interpreted. Although MRIs may have a slightly better resolution is not a drawback of ultrasound, with the resolution still being quite good. Some disadvantages and limitations of ultrasound are limited penetration in areas of air or bone and a small field of view. The ultrasound is unable to see past boundaries of soft tissue to air because of the 99% reflection rate. A bone to fat boundary is also limiting the ultrasound's penetration because of the 49% reflection. This means the area of bone and air cannot be examined by ultrasound. Another slight disadvantage of ultrasound can be that the acoustic view of an ultrasound is small, depending on the type of scan. In an A mode scan, only a single transducer is used, so therefore the field of view is limited. Conclusion. In conclusion, ultrasound is a very safe and non-invasive procedure, with many benefits outweighing the minimal disadvantages. Because of its cheapness compared to MRI, it is a much more viable option with many people. It is a valuable tool for all medical practices because of its simplicity to use. All doctors can give ultrasounds. Patients are also at a win when using ultrasounds because of the quick diagnosis of problems. This means they are able to recover quickly and easier and get back to what they love.